So the manifestations of mitochondrial failure or dysfunction can look very different in different organs. And we talked a little bit about, I have another video talking about heteroplasmy that may explain to some extent why some people manifest chronic fatigue in one or more organ systems. But if you happen to have muscles that are more likely to be affected by the infections and other stressors that reduce mitochondrial output, then you will manifest with weakness or pain in your muscles. And this would be more a picture of fibromyalgia. Some people with chronic fatigue also have fibromyalgia, but many do not. And so this is probably the reason is that if you look at the muscles of people with fibromyalgia, you see they have a lot fewer mitochondria, therefore manifesting as pain when they begin to do things, or pain with just touching their muscles. People who have more liver involvement tend to have issues with hypoglycemia, the inability to mobilize sugar from the stores in the liver, in addition to problems with multiple drug allergies, and also sometimes with swelling, because the liver also makes proteins that keep the blood in your blood vessels and prevent edema. People who have mainly manifestation in their intestines can present with either IBS, which is irritable bowel syndrome, or inflammatory bowel syndrome, which is probably another manifestation of mitochondrial disease in an autoimmune form. People who have mostly manifestation in their bladder can present with a condition called interstitial cystitis, where they have chronic pain and urgency to urinate. And people who have manifestation in their peripheral nerves can manifest with neuropathy. And people who have mainly manifestation in their brain can manifest as neuropsychiatric illness. There is some overlap with autoimmune diseases, whether they affect the brain like multiple sclerosis, or the skin like psoriasis, or the joints as in lupus and rheumatoid arthritis, are also suffering from some version of a dysfunctional processing of these viral infections. But we will discuss those in a different video, where we talk about the serology of Epstein-Barr virus and how it differs in people who have autoimmune disease versus people who have one of these chronic fatigue conditions.